And as the stay-at-home order is lifting slowly with restrictions and we move into phase 3, many people are finding they're not feeling comfortable leaving their homes. We are joined by psychiatrist Dr. Carole Lieberman to talk about why people don't want to end the quarantine. Thanks for joining us this afternoon.
Thank you.
This is such an important topic because I have spoken to so many people. You know, the beginning of the quarantine was so difficult for everybody to just have to stay inside. But now we have the exact opposite going on. So many people afraid to go back out. Tell us why.
Absolutely. And, you know, part of it is because now we're actually being allowed to go outside. So now we're thinking about it. Two of the top reasons for why we're thinking twice is because we're not so sure that the coronavirus is actually gone. You know, we're not safe from it. And of course, that and the fact that we don't know what the new normal would be, the uncertainty of it. Now, those two factors have been heightened with, of course, the problems now with the George Floyd murder and the protests and the riots and the looting. Because for a couple of reasons. First of all, people are afraid to go outside and be caught up in, in the violence, but and caught up in the transmission of coronavirus because not everybody's wearing a mask or certainly not standing 6 feet apart. And also, there already has been an increase in the number of cases of coronavirus because of these protests and because of the riots and so on. And not just because of those people getting it, transmitting it amongst themselves and then taking it home, but also because we're hearing this news and seeing this news and it's increasing our stress level. Stress weakens the immune system. And so the more stress that we're under, the more we are vulnerable to catching coronavirus. So those two aspects of why people want to stay in quarantine have been heightened because of the recent events.
Which makes perfect sense. But the question is, what do you do about that? Because, don't you worry about people's mental health? You know, they've been stuck indoors, so you worry about that. But now they're afraid to go outside. This cannot be good for our mental health as a nation.
We are suffering. Our mental health is suffering. Some people are making some rash decisions about what to do because we're not really thinking correctly, like defunding the police departments, for example, which is a ridiculous idea. We wouldn't be safe and so on. But what we need to do is we need to make sure that we include in our daily life things that will decrease our stress, things like we've heard these kinds of things, but nobody really does it, or not enough people do it. Things like listening to new age music, listening to classical music, taking walks every day, including fun in our life, not just having everything be super serious and frantic and scared all the time, and reaching out to mental health professionals. There are a lot of mental health professionals who are doing therapy online. Certainly there are a lot of hotlines, suicide hotlines, therapy hotlines, and people need to reach out. We make jokes about how every day is Blur's Day, right? We're kind of in this fog. But then when you go to try to get back to your normal life, to go out and try to get back to your normal life, it's very difficult when every day is Blur's Day. So people have to reach out for help.
I think a lot of times people are always nervous about doing that. So it's important to have a voice like yours to come up and give reassurance. Where can people go to learn more about you, find out about your blog and your podcast and everything? What's the website?
Well, there's drcarole.com, drcarole.com, and also I'm the terrorist therapist, so terroristtherapist.com, and that's another aspect. Where society is much more vulnerable now, especially if we defund the police, to terrorists. So there's a lot that we think about. It is very overwhelming, and we have to reach out, family, friends, and therapists.
Yes, well, thank you so much for coming on and sharing your thoughts today. And I think it has, those are some reassuring words to people who need to hear this. Dr. Lieberman, thanks again for joining us.